Next disease is heart failure, which means the state of heart when it is not pumping blood effectively enough to meet the needs of the body. It is also called congestive heart failure. Congestive word is related to congestion, and congestion always occurs in the lungs. It is also called congestive heart failure because congestion of the lungs is one of the main symptoms of this disease. Why congestion of the lung is the main symptom? When congestion occurs, heavy congestion occurs in the lungs, it leads to the deposition of fluid in, or you can say accumulation of fluid in the lungs, which makes the lungs heavy. All of you know heart is present in the thoracic cavity in between two lungs, and very less space is present around the heart. When fluid is present, lungs become heavy, lungs expansion become less, and that fluid also apply pressure on the heart, due to which heart is not able to pump the blood properly to each and every part of the body. Such condition is known as heart failure. Next is heart attack. Formation of clot in a narrowed coronary artery. Coronary artery are the artery which supply blood to the heart muscles. So, formation of clot in a narrowed coronary artery stop blood supply to the part of the heart muscle beyond the clot. All of you know, if some clot is there, clot means obstacle. If some obstacle is there, or you can say clot is present in the coronary artery, it will block the pathway of the blood. So blood will not be able to flow beyond the clot. The muscle cells of this part, the muscle cells of the heart which are present beyond the clot, they will die. Why they will die? Because blood is not supplied beyond that part, beyond the clot. Blood will not be supplied, due to which oxygen and glucose will not be supplied to the muscles, and due to lack of oxygen and glucose, muscle cells of the heart will die. This condition is called heart attack. It may prove fatal if the area affected is large. Conduction of electrical impulse through cardiac muscle is interrupted and heart stops beating. It is characterized by severe pain in the heart, nausea, vomiting, restlessness, and breathlessness. Simply, if we say what will happen if somewhere in the coronary artery clot is formed, due to clot, now the blood will not be able to flow to these cardiac muscles. Now we say that in this area there is a clot. Here the clot is formed. Now the blood through coronary artery will not be able to flow. In the beginning, small amount of blood will flow to this area, so less amount of glucose and oxygen is supplied to the muscles. Later on, complete blockage can also take place, in this condition no supply of blood and oxygen to these area occurs. When no oxygen and glucose is supplied, the heart muscles will die, and when these will die, they will not be able to pick up the electrical impulses through SA node and AV node, and when it will not pick up the impulse, the heart muscles of this area will not contract and blood will not be pumped, due to which heart will stop beating. So, and it is characterized by severe pain in the heart, and it can lead to the, if more larger the area affected, then it can leads to the death of the person. So mainly heart attack is a plumbing problem, which means that mainly it is because of the disturbance, or you can say effect on the blood supply to the heart muscles. Next is the cardiac arrest. What do you mean by cardiac arrest? The heart abruptly stop beating. Immediately, by any reason, suddenly it can stop beating. That is known as cardiac arrest. So cardiac arrest, in this condition the heart abruptly stops beating. There is sudden, unexpected loss of heart function and heart stop beating, which can result in the person's death. It can be here is the picture. You can see here cardiac arrest versus heart attack. Cardiac arrest is a electrical problem. Any reason can be there, either the impulses, SA node is not able to provide the impulses to the AV node, or AV node is not able to pick up the impulses from the SA node, or any reason due to which heart stop beating suddenly, and in such condition even the death of the person can take place. Whereas in heart attack, due to clot formation in the arteries, blood will be not supplied to the heart muscles, due to which death of heart muscles take place and heart will not be able to pump the blood, and which can lead to severe pain in the chest and can cause death of the person. Next is heart block. Delay in conduction of electrical impulses from the right auricle, that is through SA node, to the ventricles through Purkinje's fiber of the heart, is known as heart block. Heart block is of two types, AV block and bundle branch block. AV block means in which impulses from SA node do not reach the auriculoventricular node. SA node starts the impulses, but AV node, it is not able to pick up the impulses, or the impulses from SA node do not reach the AV node. Second is bundle branch block, where the impulses fail to reach a ventricle, when impulses do not reach the ventricles. How we can know about the heart block? By observing ECG. You can observe the second ECG. It is of the partial auriculoventricular node block. You can see here the first PQRST, and the second time, this is the normal ECG. Every time PQRST, all the waves are in a proper series. But in the second one, PQRST, then only P, PQRST, then only P. What does it show? That every time when SA node send the impulses, it is not able to stimulate the auriculoventricular node. So that's why SA node, P shows that SA node is stimulated, it is sending the impulses, but here the AV node, it is not able to pick up, due to which ventricular contraction is not taking place. This show that there is blockage in the auriculoventricular node.